main focus will be on growth. So this is the outline for the lecture this afternoon. We'll start with the definition, moving to the phases, to factors, patterns, and then measurements. By the way, I'm Dr. Angela Maliari. I'm a neurodevelopmental pediatrician. So by definition, growth is a process by which a living being or any of its parts increases in the physical size and mass, either by multiplication or by enlargement of component cells. So for growth, you can measure it quantitatively. So there are numerical values involved for growth. You can measure it either by centimeters, by meters, by feet, by kilograms. Okay? So why do we need to measure growth? Why do we need to monitor a child's growth? Because it can be considered as a vital sign in children, and aberrant growth at any point in life may already be a first sign of an underlying pathologic condition. So you have to know the normal patterns of growth so that you know that this is something that you have to investigate. So you know, or you can early detect that there is something going on with the child, and then you can also minimize unnecessary laboratory requests, tests, imaging, because when you look at the pattern, it seems that it's still within the normal range of growth, or if it's already pathologic, you can already streamline what tests you need to request for this child. Now, in terms of growth, as mentioned earlier, you can divide it into 4 phases, fetal, infantile, childhood, and adolescence. And different factors are of different importance in each phase. So there are various contributors to growth, and it may be seen in one phase, completely in one phase, or it may lead to the next phase as well. So like long-term height can be permanently compromised if one entire phase is characterized by poor health. That's why early detection and prevention is very important or critical for children. Can you hear me at the back? Okay. So during the fetal phase, this is the time where there is fastest growth because there are maternal, placental, fetal, and environmental factors that play key roles. So when we talk about birth weight, it doesn't always mean that by the time they are adults, they will be of a big size or a small size as well. But there may be factors that inhibit fetal growth that may have long-lasting effects, such as those with intrauterine growth retardation. So if they have poor weight, they are small for gestational age, that's something that you need to monitor during every visit. Now during the infantile phase, the growth is particularly sensitive to nutrition as well as congenital conditions. So genetic height may gradually become influential. So you may see crossing of percentiles in the first years of life. So did you note your disease scores? Yung kailangan nyo mag-plot kanina. Okay, so that's why it's very important for you to practice that. Every visit of your patient, you need to do that. You need to plot so you can already identify it. Is the child still within the normal range? Are we crossing percentile lines? If we are, is this something that I should be bothered about? Is this something I should investigate? Or it can still observe. So that's what's the importance of all of the things that you are doing. Okay. So during the childhood phase, it is the most steady and predictable time. So the first 2 phases, fetal and infantile, mabilis yung growth, but during the childhood phase, medyo nagsisteady na siya. Not much growth happens during this time. So it's fairly consistent for most healthy children. Now during the adolescent period, it's associated naman with a decrease. So in the first 2, fetal, infantile, there's increase up, but in adolescence, it's down. So decrease in growth velocity prior to the onset of puberty. So it's often more pronounced in males because during pubertal development, it is reliant on your sex hormones, particularly testosterone and estrogen. So these are the primary drivers of growth, and it enhances growth hormone secretion. So it facilitates your growth acceleration. So it often happens that girls grow faster, or it seems that they grow earlier, not faster, earlier than boys. So we see this when the girls are in the Tanner stage 3, when breast development occurs. But for boys, we see it during Tanner stage 4. So pubic hair development, yung equivalent naman ng growth acceleration for boys. So usually, during puberty as well, so the boys, diba, medyo slower yung growth nila versus the girls, but their growth happens longer. So sometimes makala nyo, tangkad, ano mga girls, pero later on, tumatangkad na rin. Mas matangkad na yung mga boys versus the girls kasi it happens later and longer. Okay? Now, growth, you have to remember, is an important indicator of an individual's health, the adequacy of the diet, the impact of illness, and general well-being. So, the growth of infants and children will also be indicators of health and socio-economic development of the communities that they belong. So that's why it's part of the medical history that you get, the information that you get from the parents is how is the socio-economic status. Diba, you ask what are the parents' jobs, where do they live, what do they eat daily, how frequently do they eat. So you can see how it impacts their growth when you plot the parameters. When you measure their height and their weight. So now, we need to investigate the factors that affect growth. So we will not be limited to genetics, to hormones, and to environmental factors. So let's see one by one. So genetics play an important role in growth because we do know that parental characteristics such as the height, the head size, and the physique may be transmitted from parents to their offspring. So there is a genetic rationale if you see tall children with tall parents. So if the parents are small and the child is tall, something to look into. If the parents are tall but their children are small, again, something to investigate. Kasi di ba, genetic factor, parang hindi na correlate. So also, there are genetically associated chromosomal abnormalities, metabolic conditions, and congenital endocrine disorders that may also affect the child's growth potential. So as mentioned, boys are usually heavier and taller than girls during the first year of life until the growth spurt that happens in girls during the pubertal period. So again, just to reiterate, pubertal growth happens earlier in girls, but it lasts. It happens later and lasts longer in boys. And when that happens, the boys are again heavier and taller than the girls. For race or ethnicity, it's been found that Caucasians are heavier and taller than their Asian counterparts. So I don't think this Okay, so going back to hormones, we know that especially during the prepubertal growth phase, the sex hormones have a big role in a child's growth and development. So growth at puberty is dependent with the interaction of your growth hormone, the insulin-like, all of these hormones mentioned here, insulin-like growth factor 1, testosterone, estrogen. And your thyroid hormones, on the other hand, affect the growth of the skeleton and other body tissues. So all of these hormones are important for one's growth. How about environmental factors? So these are things that you can change. So genetics, wala naman tayo magagawa dyan. Diba? If there are hormone imbalances, I think that's also something that we can address. But the most that we can modify or we can see a big change if we also change the environment that the child is in. So the timing and the chronicity of these factors are important determinants of growth. So you can see here that we can divide these factors into prenatal and the postnatal factors. So what are prenatal factors? So these environmental influences have a significant role in growth and brain development of an infant because let's say the mother had a torch infection or German measles in the first trimester of pregnancy. So we know already the outcome of the child. They may have vision impairments, hearing impairments, or cardiac problems. So we already know that with all of these combined, they may have smaller growth versus their counterparts, and of course their development may be delayed as well. Or it may also be connected, or torch infections may also be connected with their intrauterine growth retardation. So they are smaller already when they are born. Then another exposure would be to alcohol. So mothers who are not cognizant of their pregnancies or they are already cognizant but still willingly took alcohol. So any amount, there's no fixed amount na one bottle, mas mataas yung risk mo for fetal alcohol syndrome. No. Even just 1 drop of alcohol or any type of alcohol may lead to fetal alcohol syndrome. So again, affecting growth and development. Then postnatally, we look into nutrition. How is the child eating? What is the child eating? Is the child sickly? How often does he get sick? What kind of illnesses does he often have? Is it a chronic type of infection? Is it a parasitic infection? So all of these have a great impact on the growth of affected children because it affects linear growth, so their height. Okay. Socioeconomic factors like poverty also influence growth because we've noticed that those who come from poor families are smaller than their age-matched peers because of the type of food that they consume. And then cultural factors that affect feeding, child breeding may also affect one's growth pattern. So we keep talking about patterns of growth. So what are these? So actually the normal human growth is pulsatile. So there are periods of rapid growth and then there are periods of steady growth. Diba? It's mentioned, fetal infantile, fast growth, childhood, steady, and then adolescent, up again. Okay? Once the hormones work, they go up. Okay? So these are periods of growth spurts. So there are and separated by periods of no measurable or steady. Okay? So this one shows the normal growth pattern. And it occurs, the pubertal growth happens earlier in girls than in boys. So the progression of growth is interpreted within the context of the genetic potential for a particular child. So for the Filipino newborn, so these are the averages, and you need to remember this. Average birth weight is 3,000 grams or 3 kilos. Average length is 50 centimeters. Head circumference from 32 to 37 centimeters. Okay, so these are the normal values or average values. Now, individual growth rates vary greatly. So you can see here how we compare girls versus the boys. So children grow most rapidly during the first year of life, slows down during the toddler period, around 2 to 3 years of age, and then peaks again during the puberty. But earlier, later, okay? Longer for boys. Okay? Now, here naman we see that body proportion also changes as you get older. So body proportion, body shape. So dati, mas malaki yung ulo, di ba, pagkapanganak. Kaya nauunan din. Better pag nauuna yung head when you deliver normally. Kasi yung vaginal canal, at least mas ma-accommodate na yung head. Alam mo, ma-accommodate niya na the rest of the body. Okay? And then as they get older, magiging mas equal na and then smaller na yung head size or yung proportion ng head versus the total body. Now, this graph is the Scammons curve of systemic growth, and it just shows you the growth of each structure like your lymphoid tissues, brain tissues, and your genital tissues. Okay? How it happens, or the percentage of growth that you would expect from birth up until the adult years or the 20 years of life. So, moving to skeletal growth. So, it continues until the fusion of the epiphysis of the long bones has occurred. So, this happens for females at 14 and males 17. Genital tissue, so before puberty, slow growth. They double in size during adolescence. So they become mature and functional during that period. And the pictures show the development of your clitoris and your penis. So I think all of you have already experienced the changes in puberty. I guess. Noted all of the changes. We didn't know yet that there was standard staging pala at that time. Mampagulo, no? Sa alaw natin, nagde-develop. Okay. Now, lymphatic tissues are small but are already well developed at birth. The adult dimension, surprisingly, is reached by 6 years of age. Adult size naman siya. And then it peaks for about 10 to 12 years and then it gets smaller. Hindi siya nawawala. It just gets smaller as you get older. So how about the CNS? So the brain and neural tissue growth completes physical development early, but the brain continues to grow dramatically after birth. Because myelination, the myelin that covers your brain, it continues to move or continues to cover the brain from birth up until you are in your 20s. How old are you guys? Ang hina. 30s? Are you in your 30s? Ayaw sabihin. How old are you? 25. Anyone younger than 25? 21. So for those who are around 20 to 23, your brain is still developing. 25, so akala nyo that the brain is fully developed. Yes, it is. But it's still, there's still something happening up until the early adolescence. So if you feel that you're still impulsive, you're having problems with attention, so that's because myelination is still happening. So it hasn't reached fully the frontal lobe at that time. So, kaya yung cerebrum pa lang, yung complete ang myelination by the second year. So the most rapid and critical period of brain growth is between conception and the first 2 years of life. That's why early intervention is very important. Okay, again, brain growth continues until 10 to 12 years old with an increase in the size of the head due to the development of your sinuses, thickening of the scalp, and the skull. But you know, not here, it's until 20 years. How about your teeth? So dentition. So it includes mineralization, eruption, and exfoliation. So mineralization begins as early as the second trimester. So this is the mean age of your central incisors. Continues to 3 years of age for the primary teeth, 25 years of age for the secondary or your permanent. So mineralization begins at the crown, progresses towards the teeth. And eruption begins with the central incisors and then progresses laterally. Okay, from the middle to the side. Okay, and it starts usually at 6 months of age with the mandibular central incisors. The permanent teeth erupts at around 6 years of age and completed at around 18 years of age. So eruption of the permanent teeth may follow exfoliation immediately or may last by 4 to 5 months. So hindi po, diba, sometimes nawala kayo ng tooth, wala pa siyang kakaling. Diba? Marang tagal bago tumupo. And there are times naman, pagkatanggal pa lang ng tooth, meron na nakalabas. Okay? So it's variable. Then exfoliation, so with the teeth falls, it's around 6 years of age and continues to 12 years of age. So hindi tayo dapat mabibigla 12 years old, may na mga nahulog pa or nag-erupt pa na mga permanent. Now, how about if it happens early? Wala pa siyang 6 years old, nawawalan na siya ng teeth, nagpo-fall off yung teeth. So you have to investigate, is this hypophosphatasia, histiocytosis, and cystic neutropenia, leukemia, trauma, and other idiopathic factors. So it's always a cause of investigation. Okay, are you still with me? Hindi na. I need you to be with me now because we are moving to growth measurements. Are you ready? Even if you're not, we will be tackling growth measurements. Okay, so this requires accurate and precise measurements. And we will be measuring, I will be also introducing formulas in terms of how you will compute for the weight, length or height, head circumference, chest circumference, the BMI, the MUAC or the mid upper arm circumference, and the tricep skin bone thickness. So let's start with weight. So it's simple, it's reproducible. It can serve as an index of acute. Okay? Acute is weight, nutritional depletion. So if your child or if your patient is 2 years old and below and cannot stand yet, you use the infant weighing scale. Okay? So, mas precise yan. Hindi yung buhat ni mommy. Unless, sorry. Unless wala kayong infant weighing scale, it's not available in where you are working. And then, we will use the Taryn weighing scale. So, that's something I will discuss with you later on. So, looking at the picture, you see that when you weigh an infant or a toddler 2 years and below, they should be naked. Kahit yung diaper actually, dapat wala. Kasi di ba may baby, may pupo, so mabigat din yun, pwede maka-affect dun sa pag-menstruate. So dapat wala talaga siya. So, or at most, kung clean diaper kakapalit sa food, that's fine. That's negligible. Okay? Now, this is what we mean by a Taryn weighing scale. So the proper way to use it, first, turn on the scale, cover the solar panel for a second. So, dapat mag-zero muna siya bago may umapak dun sa scale. Okay? the mother has to remove her shoes as much as possible, then minimal clothing for the parent who will carry the child. So the mother will step on the scale, she will be weighed first alone, and then the baby will be undressed, at most a blanket. So the mother is to stand in the middle with feet slightly apart. There are usually marked footprints naman on that weighing scale. And then to remain still. And then, while still on the scale and with her weight displayed for the mother, we will again cover the solar panel for a second. Okay? And then, when it's back to 0, the mother will carry the baby already. So remember the steps. 0, step on the scale, so cover the panel, so it goes back to 0, mother gets the baby, and then the baby's weight will appear on the display. So that's what you're writing. Okay? Now, if the mother is quite heavy, let's say more than 100 kilograms, it does happen, so the baby's weight may be relatively low. So it may not register in the scale. So if that does happen, a lighter person, so no discrimination or anything involved. We just want to get a better measurement, a more accurate measurement. So if the mother is quite heavy, find someone who is lighter para lang makita ninyo yung discrepancy din, or you get a more accurate measurement of the child's weight. Okay? So this would be the editing to get the child's weight. So this is for if a child is unable to stand. Now, for those who are 2 years and above, can stand well, can stand unassisted, they don't need to be carried by their parents. So they can be weighed alone. So they are made to stand in the middle of a platform scale. So it's your regular scale. Make sure that it is calibrated, always ends up at 0. Okay? Or before they stand, anyone stands, the marker is at 0. Now, we do a lot of combinations in Kenya. And this is one of it. Okay, so in the infancy period, we have these mnemonics because sometimes parents don't remember what their child weighed at the time of delivery, especially if they don't have the records with them. That's why I wanted you to remember what was the average birth weight, birth length, and head circumference. Okay. So during well baby visits, we measure and then we check, we compare it to what is the ideal body weight for that age at the time of the visit, aside from plotting it on your scores. So we can determine, is this something I should be worried about? Are we still good? We can still observe. Okay? So if the child is 6 months and less, the formula is age in months times 600 the birth weight, and the answer that you will get will be in grams. While for infants who are 6 to 12 months old, the formula is age in months times 500 plus the birth weight, and again you get the weight in grams. So you will convert to kilograms if needed. So if they don't know the birth weight, use the average. What is the average? 3,000 grams. Okay? Okay. How about if you want to make it easier? So for rapid computation of weight, so this is based on Nelson's. So let's take a look at the formulas flash. However, during your exam, Dr. Military noted already that the formula you will be using is the one in the previous slide, not this one. Okay, so this is nice to know. Your must know was the one in the previous slide. Age in months, nice. Okay. Now, this slide shows the changes in weight at different ages. So you could take note that at 4 to 5 months of age, the child should already be weighing twice their birth weight. They should be doubling their birth weight by the 4th to 5th month of age. By 1 year old, they triple the weight, and so on and so on. Okay? So, during the first week of life, a newborn's weight may initially decrease by 10% or 12% depending on how the patient was delivered. So if normal delivery, it decreases by 10%. If it's cesarean section, it's 12%. So it goes lower than the birth weight in the first week of life because because there is excretion of extravascular fluid and limited nutritional intake at this time. Because they're still adjusting to life outside of the womb. So, pwede hindi pa ganun maganda yung sock, diba? Yung mga excess water, pinakabal pa sa body. So, as nutrition improves, they're able to breastfeed well or take in more milk. They should be gaining weight after the first week of life. So, they regain or exceed their birth weight by the second week of age and should grow at approximately 30 grams or 1 ounce per day during the first 3 months of life. And again, this is the expected weight gain in newborns depending on their age. So it is expected for children to gain 2 kilos per year between 2 years and puberty. So iba na to ha, toddler years na tayo, hindi na tayo sa infancy. So a pre-pubertal child whose weight velocity is less than 1 kilo per year should be monitored closely for progressive nutritional deficits so that you can provide the necessary supplements like their vitamins, or you need to modify their diets so that we are preventing other problems later on or complications later on. So, di ba, we always plot. So, you have your Z-scores, weight per age, height per age, BMI per age, etc. Length per height, length per height per age, etc. So, I think, aside from just writing down those numbers, di ba, it's easier if you have something to look at. So, when you plot it, and they visit, it's easier for you to track. How is my patient doing? How is my child? How is this child growing? So, we plot all of this on the Z-scores, and we see here already that anything below negative 2 is underweight, anything above 2 is overweight. Okay? So always remember, normal weight for age falls between 2 plus 2 to negative 2. So if it's below, paano kung it falls on the line? Normal yun. Anything falling below or above, iba na. Hindi na siya normal. Okay? Okay, let's practice. Yay! I feel the excitement, no, for everyone to practice. Okay, so you have a baby girl delivered by normal spontaneous delivery. Birth weight was 3550 grams. She was vaccinated with BCG. She was given vitamin K as well and Hepar B. There was good cry and suck and discharged after 24 hours. Mother was advised to follow up after 1 month for well baby visit. So what is the expected weight of the baby on follow-up? What's your answer? Sino malakas doon? Magsasabi ng answer. Anyone? Anyone willing to answer the question? Ano? 4,150. Let's check. Oh, so it is 4,150 grams. Diba? Lalagay nilang ng values yung formula kanina. Age and months times 600 plus 350 grams for 150. Easy? Just replacing. Okay. Next. A baby boy was delivered via low transfer cesarean section. Routine newborn care was rendered, newborn swimming was done, discharged with good suck and cry, brought in for follow-up on the 3rd month. So this was the time of pandemic. So what is the expected weight of baby on follow-up? Are you all done computing? Did you get the same answer? 4,800. Diba yan? Wala nang sumagot. for it, again, di ba, just replace aging months times 600. You don't know the birth weight, right? That's why we replaced it with the average birth weight, or what is the expected birth weight. So 3,000 grams. Okay. Next is length. So moving on from weight, we will now measure length. So if the child is 2 years and below, we use the recumbent length. So this length or height is a reliable criterion of growth because it's not affected by excess fat or fluid. That's why it's very important to measure your linear growth because it also reflects your growth failure and chronic undernutrition. So if you're looking at acute malnutrition, it's weight. If it's chronic, it is length or height. Okay? So the recumbent length is the measurement of choice for infants from birth to less than 2. Why? 2 years old, nakakatayo na dapat pag-isa. Why do I still need to get their length? Why is it lying down? But for all kids, with or without disabilities. Mas malikot yan. Hihiga mo eh. Ayaw nila ng barrel string. Diba? So why? What do we need to remove from the equation? Posture. Okay, what is better medical term? Lordosis. Diba? There's physiologic lordosis. That's why kahit patayuin mo, hindi accurate. That's why it's better that you get it when they are resting or lying. So, if you had the weighing scale for taking the weight, especially for infants, we have the infantometer. So this is the infantometer. So the child is placed supine on the board. The parent or assistant holds the infant's head. And then there's a headboard, of course, para steady lang siya doon. And then the other end, you can see, it's actually parang a board. The clinician will put it holding the baby's knees to make it straight, keep it straight, and then lie flat against the heel of the child. So you can get a better measurement of the actual length. So if the child is lying supine, this is length. Okay? Now, if they are 3 years and above, so you can already, wala na yung physiologic lordosis by this time, height is the term already. Okay? So, how do we properly measure height for kids? So, they are made to stand erect with their back against the stagiometer. So, a stagiometer is actually something that can pull down. Okay? Or if you have the weighing scales, so tinatayuan din, di ba? Tapos iaakit nyo yung, iaakit nyo yung measuring tool. Para siya may ruler sa dulo. That's also a stagiometer. The occiput, the back, the butt, and the heels, looking at the arrows here in the picture, should touch the backboard of the device for you to get the best measurement of height. Okay, so hindi pwedeng nakaslouch, hindi pwedeng nakalitit lang siya ganyan, nakalitak lang. So make sure all of these parts of the body are hitting or against the back of your stagiometer. So the external auditory hiatus, lower border of the orbit of the eye should be on a plane parallel to the floor. And then a flat horizontal board should be brought down firmly on the head so you get the best measurement. So the average length at birth, as mentioned earlier, is 50 centimeters. At 1, the average gain in length is 25 centimeters. So at the end of the first year of life, your expected length is 75 centimeters. Diba? 50 plus 25, 75. So, like in the previous topic, if you don't know or it wasn't given to you what was the height, the length of the child at the time, you use the average length at the time that a child should be born, that's 50 centimeters, or you use 25 centimeters. Kung hindi na-mention, ano yung height niya in the succeeding visits. Okay? So, you use the centimeter. So again, how do we break down? Kasi totality yun eh. In the first year of life, they should already gain 25 centimeters. So hindi siya divided equally from the first month to the 12th month. So by the first 3 months, there is a gain of 9 centimeters or 3 centimeter per month. Okay? by the end of the 6 months, there is another 8 cm increase. Breaking it down, that's 2.6 centimeter per month. Okay? So this is total 9. So kung nari sinabi sa inyo 5 months, i-break down mo yan. Okay? 7 to 9 months, 5 cm or 1.6 cm increase in length. And then 10 to 12 months, 3 cm or 1 cm increase. Okay? So lumiliit na yung increase by the end of the first year. So for 2 years and above, the formula for computing the height is age in years times 5 plus 8. I need you to remember this formula. Height in centimeter is equal to age in years times 5 plus 8. And these are the other mnemonics at I for the height, but this is nice to know. I need you to remember the formula I flashed earlier. And this is the z-score that we use, the one that we plot for the height of the patient. So anything that falls again between +2 and -2, between those numbers or exactly at the line, it is still normal. If it is below -2 and above -3, it's stunted. Below -3, severely stunted. But if it's above 2 or above +3, the child is tall, very tall. So you need to look for a possible endocrine problem or a growth hormone producing tumor. Okay, let's do another exercise. Kasi may bagong formula. Still with me? Sadly. Okay, so Ara is 3 months old during the well-baby visit, born via NST after of 99, birth weight of 2580 and birth length of 53. So she's 3 months old. What is my expected length? Tara is 3 months old. Her birth length was 53. What is my expected length at the time of this visit? Everyone done computing? What did you get?
60.
Did you all get 62? Anyone else got a different number? 59? Ano? 59, 62, 60, 61, 67? This is the time to ask questions or to make receipts. Okay. It is 62 because the birth length was given is 53. The expected increase in length in the first 3 months of life is 9. Okay? That's why you just add 53 plus 9. Try again. 10 months old. What is the expected length at 10 months old? Try that. This is the same lecture last year. Do you have a copy of last year's lecture? Oh, what's your answer? Anyone? Done computing? Uy. What did you get? 73? Anyone who got a different answer?
Average. Kasi hindi laki ni guys.
75? Okay. I need you to remember, diba? It is 73. The birth length was not given. Use the average, 50. Diba? From first 3 months, 9. Second 3 months, 8. Second 3 months, 5. So 9, 8, 5, 3. But that's collective. So you need to, pag sinabi 10 months, alanganin, diba? So you need to lessen. So hindi siya pwede mo pwede gamitin yung buo. Kasi that's collective. Diba? So 1 cm by month by 10 to 12 months. Diba? So kaya siya naging 23. 9, 8, 5 plus 1. Plus 2 cm. Yes. Pag younger, 9, let's say 8 months, 9, 8, 5 divided by 3. Diba? Kasi per month, you expect it's not 5 cm for 8 months and 9 months. Collective, 7 to 9, 5 cm. So you need to get how many centimeters talaga per month. Okay? That's why the answer is 7. Okay. Balikan ko yung slide na yun. Okay. So, di ba, the average gain in length for the first year. So, birth to 3 months, 9. But let's say, 2 months na bumalik sa'yo. So, yung 9, divide mo by 3. 3, 6. Kasi collective na. For the first 3 is 9, next 3 is 8, next 3 is 5. So, 9, 8, 5, 3. So, pag alanganin, hindi siya saktong 12 months, or saktong 9 months, parang kanina 10 months, you divide it. So, you divide 3 by 3, 1. Yeah, 1 cm per month. Okay? Is it clear? Yes, divided by 3. Yeah, 1.6 centimeters per month. So, it's good for you to know that's 9, 8, 5, 3. But you need to remember that, oh, hindi pala ako nag-end at the last. So, I need to divide. This is tricky. Kasi pagdating ng exams nyo, sabog-sabog lahat yan sa utak nyo. So, I need for you to remember it now. Because when you apply it, biglang mawawala to. Okay? That's why I want you to focus. And that's why it's good that Dr. Eleuterio gave you exercises. Okay? Okay. So, again, another must know. So, kanina, di ba, pag less than 1 kilo yung gain ng prepubertal child, investigate. If the growth velocity or the height velocity of a prepubertal child is less than 5 cm per year, monitor closely. It may warrant more frequent visits compared to your other patients. Okay. So, what are the normal variants of your linear growth? Diba? So, just because you took it, you measured it, you plotted it, tapos you see something there's wrong, doesn't always mean, diba, na I have to investigate. That's why you need to know what is normal and what is not. So, there may be familiar, short stature, or delayed constitutional growth. So, what is the difference of each? So, we see here the different features of familiar, short stature, and constitutional delay. So, there is genetic predisposition for growth. And you can see here in the familial short stature that parents who are small, a child may have inherited bad features. So they end up with a short stature in the adult years, but they had normal growth parameters and growth rate since birth. Okay? Kaya sabi ko sa inyo, di ba? If the parents are small, the child is small, genetic factor yan. But if the child is small, if the parents are tall, bakit? Investigate. So if a parent comes to and they are small and the child is small, you can assure them. Kasi normal po yung mga parameters naman natin. And this is the expected trajectory for your child because your heights are average or smaller for your age or your gender. See? So, normal ha. But when you look at constitutional delay, parents may be of average height but with delayed puberty. Okay? The birth length, growth rate at the onset was normal, but they have also late onset puberty, so there's delayed growth age. So they may have have first or second degree relatives with the same condition. So, normal adult height eventually, but, sorry, so I need you to remember again, familial short stature, normal, for constitutional delay, slow or delayed. Okay? Ang normal lang nila pareho, birth length and growth in the first years. The rest for constitutional delay is delayed. Okay? Clear? Clear? And then the adult height eventually becomes normal for constitutional delay, but for familial short stature, it remains short. Okay. So there are two methods to measure the predicted height. One is projected height and the other through mid-parental height. That's why you also get to measure the parents' height. So projected height is determined by extrapolating the child's growth along the current channel to the 18 to 20-year mark. So it can be compared with a calculated mid-parental height to determine if the child's growth is consistent with their growing potential. Genetic potential. So projected height for a child older than 2 years can be determined by, again, extrapolating the child's growth along the current channel to the 18 to 20-year mark. So in this example, the 6-year-old boy is 110 centimeters. Note the arrows. Okay, that's 0.8. So which is at the 15th percentile at the time. The projected adult height, if he remains to be in the 15th percentile of an 18-year-old, is 170 centimeters. So this is projected height. Just following the graph. Okay? Madulo ulit. Dahil correlated siya with genetics, especially, parental height. We need to calculate sex-adjusted mid-parental height by assessing growth to avoid misclassification of abnormal growth. So for girls, the formula is father's height, that's FH. Father's height minus 13 centimeters plus mother's height divided by 2. For boys, balitarin nyo lang, maternal height plus 13 centimeters. Bakit? Kasi, di ba, mas matangkad ang lalaki kaysa sa babae. So roughly the average, the difference in height is around 13 centimeters. Okay. So babalitarin nyo lang. Pag lalaki yung pasyente nyo, maternal height plus 13 plus father's height divided by 2. Pag babae ang pasyente nyo, father's height minus 13 plus maternal height divided by 2. Okay. Okay? Okay ba? So for both girls and boys, 10 cm on either side of this calculated value represents the 3rd to 97th percentile for anticipated height. So, pag nakuha nyo na yung value niya, plus or minus 10 centimeters or 4 inches. Practice. Practice. So, you have a 3-year-old boy with a height of 7 and 9 centimeter. The father is 190 and the mother is 155 centimeter. What is the mid-parental height? Anyone done? Ano? 179. Anyone else who got a different answer? Anyone? Hey, come on. Lalabas sa test na to. Easy. Sabi ko sa inyo madaming formula ang rule. Sides out. Ngayon lang naman yung bawal kayo may kodigo ng formula. Kasi residente naman kayo.
Si Sanya ba?
Sa kakagawa na din yun, hindi na yapakan. Kahit tulog ka magagawa. Okay, the answer is 179. So going back, diba, maternal height plus 13 cm plus father's height divided by 2. Just plug in the numbers. The mother's height was 155 cm plus 13 cm plus 190 cm divided plus by 2. So 179 cm yung expected or genetic target height of this patient plus or minus 10. Okay? Plus or minus 10. Sanya is 5, has a height of 91. Mother's height is 155. Father's height is 173. What is her mid-parental height? Just plug in. I need you to remember the formula. Plug in the numbers. So this time the patient is a girl.
Sanya ba? Iba ba? Yes. 157. Minus kapag ano, girl.
Minus kay Yes.
Yes.
Sa lahat kay sa lahat plus. Tapos ang fiber. Sa mother ang minus. Ay, sa father. Fiber na plus kay
Good? You already have the answer? Yes? What's your answer? 157. Siguro may notes na kayo ulit mga... I need you to practice, ha? Even if you have the notes from the previous year, I need you to practice. Okay? Okay. So the answer is 157.5 centimeters. So again, with parental height, father's height minus 13 centimeters plus maternal height divided by 2. Always take note it's in centimeters, ha? Because if you're given values that are not in centimeters, you have to convert. And then you add plus or minus 10. Okay? To determine the genetic target height range. I will end here. Yes. Dami pa nito, no? May circumference pa kayo, may mid-upper arm circumference pa, tricep skin fold thickness test. Tapos may depth pa. Oh my God. Milestones naman tayo next week. So you have formulas and then you have milestones. I wish you all the best. Questions before I end your meeting. Any questions about the topic?
Mag 1 hour lang daw siya. Yan yun, diba?
Kasi naman.
So we'll